Hi, I'm Andrew. I used to be in the financial services industry. I retired 5 years ago. I was diagnosed with MS 10 years ago. My doctor said that it would be good to reduce stress. It took me 5 years to figure out that that involved quitting my job, but I did.
Traditional Chinese medicine views incurable diseases a little differently than in Western medicine. Although we can't outright cure an incurable disease, we can help with the symptoms. So in cases of HIV, cancer, MS, these are all things that I treat in my day-to-day practice. My goal is to just relieve some of the symptoms of discomfort and pain that patients may have.
It all began with the strange tingling in my left foot that continued to spread all the way up my left leg, up to my rib cage, and then down my right leg. After numerous trips to the doctor, we finally did an MRI, which determined that I did in fact have MS.
In Andrew's case, doctors are disputed about what is the underlying cause of MS. Some feel that it's related to vascular blood flow to the head region, and others feel that it's an autoimmune disease affecting the nerve cells. But in Chinese medicine, it actually has to do more with, most of the time, the kidneys and the spleen.
MS is a disease of many symptoms, but not many solutions. If you see a medical doctor, it tends to be addressing a symptom at that moment. And I guess in a sense the shiatsu is as well. The difference is that the shiatsu seems to provide ongoing relief, particularly, for instance, in the stiffness of muscles. So instead of taking a pill, I get this done, which provides me, I think, longer lasting and more effective relief.
Techniques I use to help Andrew, we use mostly shiatsu and acupuncture, and I will insert needles in the back of his legs along the spleen meridian, the kidney meridian, and help some of his day-to-day symptoms. He suffers from muscle rigidity, insomnia, and extreme afternoon fatigue. And the acupuncture can treat a lot of these symptoms, and the shiatsu will help relax the body to kick in the effectiveness of acupuncture.
I find shiatsu provides a good sort of balancing of energy so that the fatigue seems less pronounced. In terms of the periodic aches and pains that pop up, I find that there's much more instant relief when Sarah targets a particular area, like a short shoulder or a bad hip or something like that.
So basically, shiatsu will relax the body and make the needles work more strongly, more efficiently, and the patient will be relaxed all the while. I
went and saw her. I felt an immediate connection. I think she has a very level-headed, holistic approach, which I appreciated. For people with MS, for every person, it's an entirely different journey. I find that the shiatsu is a very good addition to all the other things my medical doctors have me do. It's part of an overall picture that's made the disease a lot more manageable for me.